This episode is brought to you by Google Gemini. With the Gemini app, you can talk live and have a real-time conversation with an AI assistant. It's great for all kinds of things, like if you want to practice for an upcoming interview, ask for advice on things to do in a new city, or brainstorm creative ideas. And by the way, this script was actually read by Gemini. Download the Gemini app for iOS and Android today. Must be 18 plus to use Gemini Live.
Hey, it's Austin James. Yes, I'm living with diabetes, but it doesn't have to define me. Thanks to the Freestyle Libre 3 Plus sensor, I get real-time glucose readings throughout the day. The Freestyle Libre 3 Plus sensor is small and easy to wear, giving me the freedom to focus on my life as a parent and a musician. Now this is progress. You can get a free sensor at freestylelibre.us.
Offer available for people who qualify. Visit myfreestyle.us to see all terms and conditions. Certain exclusions apply. Data on file. Abbott Diabetes Care. For prescription only. Safety info found at freestylelibre.us.
This episode is brought to you by Amazon Prime. There's nothing sweeter than baking cookies during the holidays. With Prime, I get all my ingredients delivered right to my door, fast and free, no last-minute store trips needed. And of course, I blast my favorite holiday playlist on Amazon Music. It's the ultimate soundtrack for creating unforgettable memories. From streaming to shopping, it's on Prime. Visit Amazon.com/Prime to get more out of whatever you're into.
Here we go.
I almost threw up that time.
Man, you are one pathetic loser.
Blah, 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 blah. See? That's the things that are coming out of your mouth.
You get nothing. You lose. Good day, sir.
Well, that's because you're an idiot.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by two really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my incredible woes. I want to take my brain now and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in a tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve. Dr. Steve!
From the world-famous Obnoxious John Network Studios in beautiful downtown Tukey City, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medicine provider, gives me street cred, the whack alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
My partner in all things, Tacie. Hello, Tacie.
Hello.
This is a show for people who had never listened to a medical show on the radio or the internet. If you have a question, you're embarrassed to take your regular medical provider. If you can't find an answer anywhere else, give us a call, 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcast, medical stuff, medical news and stuff you can buy. Most importantly, we are not your medical providers. Take everything you hear with a grain of salt. Don't act on anything you hear on this show without talking over with your healthcare provider. Don't forget stuff.drsteve.com, stuff.drsteve.com. One of these days I will make it worth visiting, but please visit it anyway, and then let me know what you want to see on there. But right now, check out the Roadie robotic tuner. It's fantastic. And one of my favorite things, just a robot tuner. You put it on the peg, you flick the string, it tunes it for you. And it will also unwind or wind when you're putting new strings on. Check out Dr. Scott's website at simplyherbals.net. Check out patreon.com/weirdmedicine. I've got some new ideas for projects, and all of my YouTube shorts go there first before anybody else sees them. And then cameo.com/weirdmedicine. I think we have a cameo to do today, by the way, as soon as we finish with this. And cameo.com/weirdmedicine. For $5, I'll say fluid to your mama, or I'll answer a medical question, although you can do that by just dialing 347-766-4323 and just asking a damn question. It's free. Anyway, but if you want a video response and you want it to, persist for the rest of your life, then feel free. Cameo.com/weirdmedicine. All right. Check out Dr. Scott's website at simplyherbals.net, simplyherbals.net. And I see you brought some Stress Less.
That's right.
Which one of us needs today. And some of your Simply Herbals CBD nasal spray.
That's right. Like the special stuff with the special sauce.
That's the good stuff. All right. Thank you. And then, check us out at drsteve.com. We'll have a new website one of these days. And at Normal World, I'm a little bit behind on doing my pieces for Normal World because I've just been busy AF, but I'm going to get back on that. And I'm supposed to have one every 2 weeks. They went on vacation, and then we went on vacation. It's been a while. So, but Normal World with Dave Landau, and check out davelandau.com. He has a YouTube video right now where he's dealing with a drunk heckler. And it's a 3-part thing. It goes on and on and on, and he is hilarious. He's one of the funniest people I've ever seen. Don't you think so?
Yeah.
Yeah, I love him. Anyway, all right, very good. Tacie, you have any things to do today?
I sure do.
All right.
It's Tacie's time of topics. A time for Tacie to discuss topics of the day. Not to be confused with Topic Time with Harrison Young, which is copyrighted by Harrison Young and Area 58 Public Access. And now, here's Tacie.
Hello, everybody.
I think we can. Hello. Well, I think we can probably get rid of the disclaimer one of these days. I'll shorten that. You know how It's Always Sunny in Philadelphia had that big long theme song, and then by the end it was just like 2 chords.
Yep.
So we'll do the same thing. Anyway, what
we
you
need
got?
to finish that, by the way.
Yes, we do.
Yes. The first one is about Celine Dion and her battle with stiff person syndrome.
Celine Dion.
Celine Dion. Excuse me, I've had a couple of mimosas.
Okay.
Slim Dion.
A rare autoimmune neurological disorder. SPS causes muscle stiffness, painful spasms, and coordination issues, while incurable treatments can improve quality of life.
Yeah, I think a lot of people were confused about what's going on with her, if they think about her at all. But, they know that she's been ill, and I've heard that some people thought she had cancer, other people thought she had Parkinson's, but it's not actually correct. She has stiff person syndrome.
Yeah,
so
she
tell us about that.
described the condition as feeling like somebody is strangling you and affecting her daily activities, including cooking and singing.
Cooking? Yeah, right. Okay, do you think she does her own cooking? Get out of here.
She has a team of
She doesn't
chefs.
eat.
A team of chefs.
Well, she may now do her own cooking.
SPS impacts Diane's throat and abdominal muscles, even breaking a rib during one severe spasm.
Oh, God.
The condition has significantly altered her life and career.
I want to make fun of her about her cooking like a little piece of celery for, calling that cooking.
Exactly.
But I can't make fun of her now because this is horrible.
Yeah.
It is terrible.
Dr. Scott Newsom from Johns Hopkins Medicine explains that SPS results from a hyperexcitable nervous system. Diagnosis is challenging, often requiring specialized tests and neurologist referrals. SPS typically develops between the ages 30 and 50, causing muscle stiffness, painful spasms, and mobility issues. Symptoms may include irregular gait, postural changes, and increased risk of falling. Emotional distress, anxiety, and depression are common. Dr. Newsom describes SPS as a spectrum disorder with symptoms evolving over time. Variations include classic SPS, focal SPS, and SPS with cerebral ataxia.
That means, or it's probably cerebellar ataxia. And those are people who can't walk.
Right. Balance.
They have no terrible balance, and they're just, walking around like a drunken sailor.
Disconjugate gait.
Correct. Very good. If they're even able to walk at all.
Yeah.
So.
Dr. Newsom describes SPS as a spectrum.
You got that for disconjugate gait.
I already read that one.
Oh, you did?
Yeah, while the exact cause is unknown, scientists have linked SPS to an antibody called GAD65.
Right.
This antibody targets glutamic acid decarboxylase.
Glutamic acid decarboxylase. And, it's an enzyme that, decarboxylates glutamic acid. And if you don't do that, glutamate builds up in the between the nerve endings, and you get these problems. My question is, why they say they're not sure if the antibodies are clinically relevant, But it certainly makes sense. You know, we have the same sort of thing with ALS too. There's some, glutamate issues.
Right.
It's pretty toxic if it builds up. Why not do a study on a monoclonal antibody that attacks the anti-GAD65 antibodies and just see? Surely to goodness I'm not the first person who thought of this.
No.
It's such a rare disease that they're not, just pouring
money into it. Yeah.
We were talking about a Canadian treasure. They should be.
Yeah.
Says it makes patients sensitive to triggers like stress and loud noises. Treatment for SPS involves a multi-pronged approach. Immunotherapies target the immune system, while medications like benzodiazepines calm the nervous system. Physical interventions such as stretching, massage, and yoga can help with pain and mobility. This combined approach can improve quality of life and potentially slow progression. Celine Dion's public diagnosis has raised awareness of this rare condition.
Yeah, it's sad that you have to have somebody famous to... when Ronald Reagan had his colonoscopy, he had colon cancer, and they found a cancerous polyp, I guess, if I remember right. I just remember he had a colonoscopy, and all of a sudden people were aware of colonoscopies. It's like, why did we need that?
Yeah.
Now, I have some other things here. Tacie, it says intravenous immunoglobulin, so I give myself a bell for that. That would be groups, other people's antibodies, basically. They say it's safe and effective treatment for stiff person syndrome. Uses the antibodies to help reduce the stiffness and improve balance. And in this article, it doesn't say why, but it would be because they're probably blocking those other antibodies.
Gotcha.
But anyway, so IVIG can help with reducing stiffness and decreasing falls, et cetera, et cetera. Plasma exchange is one. And oral immunosuppressant therapy. So she certainly can afford the best doctors in the world, so I'm assuming that she's doing all these things too.
Yeah.
She just doesn't want to dox herself with all the stuff that she's doing.
Yeah. The stiff person syndrome, there's also a stone man syndrome.
Correct. And that's not the same.
We've talked about before on this show, but it's been a while.
Okay.
A 10-year-old Pakistani boy presented with painful lumps on his back, stiff shoulders, neck, and left hip. He underwent surgical excision of the left hip ossification, which worsened the condition. Radiological examination revealed widespread heterotopic ossification while blood tests were normal. The patient exhibited multiple swellings on his back, shoulders, hip, and knee. A painful mass was noted on his left arm. All visible masses were tender and abdominal and paraspinal muscles were stiff. Shoulder movement was severely restricted. The boy had bilateral hallux valgus, a limited mobility.
Okay, we should talk about what
hallux.
So the hallux is the big toe, and valgus means that, so varus and valgus. Valgus means that it's pointing away from the midline of the body. So it's just it's a crooked toe, basically, is what that is. And when you talk about ossification, what they're talking about is bonification, not that kind, Dr. Scott, that you're thinking about.
Of course.
Bonification of tissues like joints and muscles. And
right. There's bonification where there shouldn't be bone.
That's right.
Bones being laid. New bone being laid.
Correct.
Yes.
Lab results were normal, but genetic testing wasn't done due to financial constraints. X-rays showed widespread heterotopic ossification. Previous surgery on the left hip initially improved mobility but led to worsened ossification. The patient received symptomatic treatment and counseling. His family was educated about the disease and advised to prevent trivial trauma. Hybrodysplasia.
No.
That's a big word. I said it right. Ossificans progressiva.
Ossificans progressiva. Or progressiva.
Progressiva. Also known as Stoneman syndrome, is an extremely rare genetic disorder. It causes progressive bone formation in soft tissues, leading to severe disability. It affects 1 to 2 million people worldwide. It's often misdiagnosed, resulting in unnecessary and harmful interventions. It sounds like everything you do to try to help this makes it worse.
Yeah. That's a rough one.
Yeah. It says early diagnosis through clinical examination, radiological evaluation, and genetic testing is crucial for proper management. The disorder typically begins in the first 2 decades of life with no demographic preferences. It's characterized by abnormal big toes and progressive ossification of connective tissues.
And it's also a rare disease, so that's the other problem with it.
Yeah, causing permanent disability.
Yeah.
FOP is caused by mutations of the ACVR1 gene. Physical therapy for FOP patients should focus on improving daily activities while avoiding passive movements that could trigger flare-ups.
Right. Yeah. So, again, one of these things that maybe CRISPR in the future may solve. We got Huntington's disease be a good one. This is one. If we could just go in and change their genetics, we couldn't reverse the problems that they already have, but we may be able to stop it.
Yeah. Yep. It says trauma, including injections and dental procedures, can cause flare-ups.
Right.
Patients may be at higher risk after flu-like illnesses. So subcutaneous flu vaccines are recommended, especially for those with chest wall restrictions.
So, yeah. So there are other things like this. So people who have psoriasis will notice a thing called Kebner phenomenon. And what that is where they get a little bit of trauma to the skin, all of a sudden a plaque will grow. And you can draw things on someone's skin and it'll make psoriasis plaques. I mean, it's not a fun game or anything, but you could do that. And so like if a cat scratches their arm, they'll form those plaques there. So it's the body's response to trauma. And in this case, instead of making a psoriatic plaque, they form bone.
Laying down more bone.
Yeah.
Yep.
Corticosteroids are used for flare-ups affecting major joints, jaw, or submandibular area, but not for back, neck, or trunk flare-ups.
Yeah.
NSAIDs or COX-2 inhibitors with leukotriene inhibitors may be used when stopping prednisone. However, these treatments didn't halt progression in our patient.
Okay.
It's incurable.
Yeah.
Ugh.
You got anything else?
I have a couple of really boring ones.
Okay, we'll do those next week.
Okay.
We already did 2 boring
I thought Slim Dion was
very interesting.
Well,
Slim Dion was good.
I mean, there's one that
that old Slim Dion. What do you got?
Did you hear about the millions of Americans to see reduced medication costs in 2025?
No.
A new AARP report reveals that by 2025, more than 3 million Americans will save over $1,000 on their prescriptions due to the Biden's administration Inflation Reduction Act.
Oh, I see. Okay, Inflation Reduction, where they plowed more money into the economy. So, yeah, you can't listen.
We're going to get in trouble.
I don't care.
Okay.
This is a thing that has to do with medication and playing politics with people's medication. It's no coincidence that this is coming out in an election year,
an election cycle. Yeah.
And listen, I'm not a Democrat or a Republican, but I care about our patients, which should be a given. So I can't virtue signal on that. I don't want to sound like I'm virtue signaling on that, but this could have been done 4 years ago. Why is it being done now?
Or 15.
And why are we hearing?
Yeah, a long time ago.
Why are we hearing the candidate now saying they're going to fix all this stuff when you're the one that's you're the incumbent?
Yeah,
basically.
so there's supposed to be.
So why didn't you fix it while you were the first 4 years?
A $2,000 out-of-pocket cap instituted.
Yeah, that's not reducing inflation. It's reducing cost. It's not the same thing. And it's reducing prices. It's not the same thing as reducing inflation. Because when you do that, if the pharmacy now can't charge you anymore, what they're going to do is they're just not going to carry the drug, or they're only going to carry generics, or they're just going to go out of business.
That's all they're using anyway right now is generics.
Unless
these Medicare patients.
Yeah, but if they can't if you just artificially cap costs, then people are going to go out of business. People are going to lose jobs.
Yeah, drug makers are not happy with this and argue the law will hurt consumers.
Yeah, well, yeah, because they're not going to eat it.
No,
we're going to eat it. Yeah. That's the problem. I mean, there's a lot of shit to go around, but these sort of artificial policies like that, and look, I want everybody to make a ton of money, one of the things that they've seen in California is the loss of entry-level jobs because this is what I understand from my friends who live in California, that entry-level jobs are disappearing because the minimum wage has been raised so high. Gotcha. And those are jobs for people like our kids who have not had a job before that need to just get started and
learn some things,
learn how to be responsible,
learn how to show up, learn how to do a bunch of different things.
Intended to be career jobs, but I know they can be for some people. And there's got to be some sort of middle ground there. My thing is, and I'll shut up. I would not own a small business if I didn't give my employees a piece of the action.
Right.
That's how you do this. Now, you can't mandate it, but I think you're crazy if you own, let's say, a shop where you're making candles, and it's not a franchise. You make them in the back, and you hire, let's say, a college student, and you pay her $12 an hour. Which is not, here, what's minimum wage here? Like 8?
8, yeah.
Something like that. So it's a little bit over, but other places are paying 15, starting at 15. Why would you do a good job? Why would you care?
Yeah, exactly.
Right? You want to keep your job, so you're just going to do the minimum to keep your job. Whereas, hey, if I do a survey and everybody says you were really nice, to them, and they felt happy to be here, I'm going to give you a bump. I'll give you a bonus. Or how about this? If we sell a shitload of candles because you're out there barking at people, and to get them in and selling them candles and giving them deals and doing all this stuff, I'll cut you in for 5% of the profit or something.
And the other part of that is reducing overhead. If the people realize if they work harder, maybe they don't throw away that paper.
Yes.
Maybe they don't throw that extra tape in the trash or whatever.
Give your employees a reason to want your business to succeed.
Yep,
and when you do that, it solves 90% of these problems.
Totally.
I would never own a small business without giving my employees a piece of the action.
Yep. Even a big one, I think.
Yeah.
No. I think any kind of...
Well, a lot of the big ones have profit sharing, but I think even on a small level you can do that.
Yeah, I agree.
But anyway, all right. I'll shut up. I'm an idiot. All right. Okay, we done?
I have other boring ones, but they're really boring.
Okay,
so.
well, all right. That was a good one, though.
That was a good one, Taste.
Yep. All right. Let's try this. Let's see here.
This episode is brought to you by LifeLock. The holidays mean more travel, more shopping, more time online, and more personal info in places that could expose you to identity theft. That's why LifeLock monitors millions of data points every second. If your identity is stolen, their U.S.-based restoration specialist will fix it, guaranteed or your money back. Get more holiday fun and less holiday worry with LifeLock. Save up to 40% your first year. Visit LifeLock.com/podcast. Terms apply.
This episode is brought to you by AWS. Amazon Q Business is the new generative AI assistant from AWS. Many tasks can make business slow, like wading through mud. Help! Luckily, there's a faster, easier, less messy choice. Amazon Q can securely understand your business data to help you streamline tasks, like summarizing quarterly results or doing complex analyses in no time. Q got this. Learn what Amazon Q Business can do for you at AWS.com/learn more.
Come to me. Focus Features invites you to succumb to the darkness. Nosferatu. From director Robert Eggers comes a masterpiece of horror. He is coming. This creature is a force more powerful than evil. It is death itself. Nosferatu. Rated R. Under 17nm without parent. Only in theaters Christmas Day. Special engagements in Dolby and IMAX.
Looking for a pickup truck to get just about anything done? Look no further. The Chevy Silverado EV isn't just the most powerful Silverado ever, with next-level towing capability and technology. It also offers game-changing versatility with the available multi-flex midgate and tailgate, which means Silverado EV helps you carry large, bulky, and oddly shaped items up to nearly 11 feet in length. Chevrolet. Together, let's drive. Visit Chevrolet.com to learn more.
This year, Santa's bringing the power of Energizer into his workshop.
Whoa, the Energizer Bunny's got so much power.
Wait, he's powered up all the toys. I think that means we're done for the year.
I love this bunny.
He's the hardest working helper the North Pole has ever seen. And he wants all your gifts to have the power of the #1 longest lasting AA battery. So this holiday season, stock up on Santa's and the elves' favorite battery, Energizer Ultimate Lithium.
Number one thing, don't take advice from some asshole on the radio.
All right. Well, I won't do that, Ronnie B. What I'm going to try to do, though, is to... Oh, there we go.
Hey, Dr. Steve, I just had a question about, I talked to you before I actually emailed you, and you emailed me back right away.
Yeah.
Which I appreciate, about quitting smoking.
Yeah.
So I finally have quit smoking, but
Excellent.
I substituted it for this vapor thing.
Okay, yeah.
So it seems to be kind of all the rage, and I love it. I don't wake up with a 25-pound weight on my chest anymore.
Right. I hated that.
I seem to think it's working because I can know the milligram of nicotine that I'm taking, and I've weaned myself down to about 1.5 milligrams per dosage, which is approximately 10 milliliters or something like that. Anyway, I wanted to see what your take was on the whole vapor thing. Thanks.
Yeah. And before I get to that, there's some comments in the chat room. By the way, if you want to join the Fluid family in the waiting room, I'm not saying yuck to the Fluid family. We love them, but it's just stupid names. Go to youtube.com/@weirdmedicine. Turn on the notifications, and when we're recording live, then you can join in. And there's some really good comments here. Talk Like a Hick to You says they're hiking prices now, so that if they, quote, reduce it later, it'll just be back to where it was, like stores during Black Friday sales. And ORS at the movies says they do that a lot. Hike the price, then reduce it. It's still above where it was, but they claim they lowered the price. So there you go. You know what? Yeah, that's. I suspect that that's true. I wonder what the evidence is.
I don't know.
It certainly seems true.
Well, if there's a $2,000 maximum limit on what they can pay, then...
Yeah. Well, true. Yeah, that's a good point. They're not just saying, they're not cutting it by 10%.
Yeah.
They're actually capping, and that is a little bit different. But still, I see these things. I like it when they go, buy 2, get 1 free. So you're buying 3 for the price of 2. How about you just sell me 1 for 2/3 the price?
Yeah.
And you could just do that anyway. But it's some sort of psychological thing. And I think it's a psychological thing for them too. That you're moving more product, but you're making less on it. So, but I guess volume really does matter. My dad used to tell a joke about a guy that had a business, and he said, "I buy these widgets for $10 and I sell them for $8." And, I sell a lot more of them. And I said, "Well, how do you make any money on that?" And the guy goes, "Volume."
Yep.
Right? So think about it just for a second. But anyway, yeah, if you sell a lot of... Anyway, I don't have to explain it. You guys are smart. All right. So vaping. Let's talk about vaping. So we have talked about this before. Back in a few years ago, there was that scare where they were using apparently like vitamin E or something, liquid vitamins to solubilize the vape with, and people were getting
popcorn.
Popcorn lung.
Horrible lung diseases from this. But that I haven't heard about any of that in quite some time. I think it's all settled down.
Good.
And but there's a lot of studies that show that e-cigarettes with nicotine may help adults quit smoking compared to e-cigarettes without nicotine or no treatment. We still don't know what the health effects of e-cigarettes are long term, but we believe that they are less dangerous than smoking. Smoking, you get carbon monoxide, you get tar. Tar is what causes the cancer. The nicotine promotes the cancer and also is a vasoconstrictor, so it promotes heart attack and stroke. But if you're just getting the nicotine with the goal of getting off of it. Mm-hmm. So Rich Voss, our friend, which, by the way, gave me a really good joke for my roast that I used. It's on our YouTube channel, I think. I'll put it up there at some point. I know it's in our Patreon channel. The Roast of the Dabbleverse. I recorded mine remotely, but Voss gave me a good joke about Shuli. I'll tell it now. It said Shuli Agar, a comedian, is at war with Kevin Brennan. Who was the other one? Oh, Kevin Brennan, Patrick Melton, and Stevie Liu. And I said, even Netanyahu told him to slow it down. So anyway, I delivered it much better that day, Anyway, so the e-cigarettes, pretty good. Voss got off smoking. He used to smoke, and he no longer smokes, but he got off of cigarettes with nicotine gum, and he still chews it. I mean, I heard about this one
for years.
Yeah,
right?
I heard about this one the first time he was on Opie and Anthony. That was like 2005. So yeah, it's been decades now that he still does the nicotine gum. So that's still safer than smoking, and that's probably safer than vaping. But there's still nicotine in it, and if it still constricts the blood vessels and is a tumor promoter. I have a lot of patients in my practice that say, well, now I have stage 4 cancer. Why should I quit smoking now? And it's like, well, if they are terminally, close to the end, it's like, well, I'm not going to take anything away from you that you enjoy. Right on. But if they are engaging in treatment, then there is a reason to stop smoking. And it's because nicotine promotes an enzyme called protein kinase C. And protein kinase C is activated by nicotine, and protein kinase C promotes tumor growth. So in a lot of tumors. So there is a reason to smoke, and you feel better too. All right. Yep. All right. FDA has approved medication to help people quit smoking. They're mostly safe and effective. One of them is not, one of the oral ones is not allowed to be taken by airline pilots. That would be Chantix, by the way, because it causes dysphoria and weird dreams.
Is that the same as Wellbutrin?
No, that is that one was Zelnorm, I think, was the name that Zyban. They used Zyban. Was now it's generic. Wellbutrin is bupropion. It worked wonders for me. Well, I was just looking for a pill. Yeah. I could quit smoking for 6 weeks, 12 weeks, even a year, but I'd always start back up again, and I just needed a pill to help me. I think some of it was psychological.
Yeah, get over the hump.
But that I started taking bupropion back in the day it came out, and I never looked back, and I haven't smoked since. And that was over 25 years ago, I think. So there you go. Whatever it takes. But if you want to quit smoking and not vape, then Scott was a tobacco addict, but he dipped. But he'd slip a little Twix cheek and gum,
Right on.
But I would quit and counsel people if they don't want to take a pill or they don't want to do patches or all that stuff, rather than to quit by number. In other words, some people would put 19 cigarettes in a bag and then 18, and then don't do it that way. Do it by time. So I would smoke 2 before I hit the shower every morning. So the first day, I didn't smoke those. And the head of my cock was very thankful, because when you're flicking cigarettes between your legs, sitting on the pot, then you're burning, the top of the Roman war helmet frequently. So that was pretty stupid.
And how many times did you have to do that before you figure out that's a bad idea?
Oh, it doesn't matter. It doesn't matter. The smoking.
That's true.
Seriously, it didn't matter. I did it for years, and it happened, once a month or something like that. And so it didn't stop me from smoking. Nothing stopped me from smoking except cancer didn't stop me from smoking. Heart disease, stroke, none of that. It was when I finally learned the statistic that the vast majority of impotence in men over 40 is caused by tobacco abuse. Boy, did I pay attention then. But, so the first time I didn't smoke those 2. And then the next day I didn't smoke on the way to the hospital. And then I started doing it by time. So 9 o'clock, 10 o'clock. And then after you hit 10 o'clock, if that's your day, you can smoke as much as you want to. And then 11 and 12, and you just march around the dial. Now, you can stop on a time for a day. That's the rule. If you have a bad day, you can stop at 6 and then the next day still do 6, but you can never go backwards. That's the rule. And you keep pushing it until the first day that your time to smoke is after you go to bed. Now you're done smoking. Okay? And that gives you time to think about it, but that allows you to smoke as much as you want to after the time, but you can't smoke an infinite number of cigarettes. So when it gets, if your bedtime's at midnight and the time you can smoke is 11, there's a limited number of cigs you can smoke. So it gets you acclimated to not smoking, and then you're sleeping through that first big block of time when you're not smoking. You wake up the next day, you throw all your paraphernalia away, and start acting like a non-smoker. If you fake it till you make it. And the first day, you can go by all those people in the middle of February in Minnesota that are sitting outside the hospital, shivering, smoking cigarettes, and go, what a bunch of dumb assholes. And that used to be you yesterday, but it isn't today, so you can feel superior to them right now. And also think of all the RJ, well, I don't want to, the tobacco big wigs in Durham, North Carolina, who go, ooh, yeah. Every time you buy a pack of cigarettes, we got them to get another one.
Yep.
Right? We got them now.
Hooked them.
Yep. So
I love it.
They're happy. They're happy when you go and buy a pack of cigarettes. So remember that. When you give them your money, they are thrilled. So maybe that'll help. Anyway. All right. Okay. Done that one multiple times, but I don't think it's too many times you can talk about
Steve,
smoking.
my name's Al. I'm having trouble with my ball sack scrotum.
Yeah. We know what a ball sack is.
Sitting down or walking. Has anybody ever had a surgical lift?
Yeah.
I seem to have to lift my scrotum
so you don't sit
when I'm
on
in
it.
bed at night to feel better. Or like I said, walking, I have to pull them forward.
Oh.
And I've never heard of it.
What about sitting on the pot and it gets between the seat and the... Can you imagine? That would hurt so bad. All right.
Anybody having surgery of having them?
Absolutely, my friend. It's called scrotoplasty.
There you go.
And it's a surgical procedure. It repairs or creates a scrotum. And it's also known as osteoplasty or a scrotal lift.
Ooh.
And it can be performed for a number of reasons. Some of them are serious, like birth defects, injuries, stuff like that, or cosmetic reasons, such as scrotum skin tightness or a too floppy scrotum.
Sagginess.
Yeah, saggy scrotum.
Gravity.
And they remove the sort of elongated tissue and then close the incision to create a smoother, more youthful appearance of your scrotum. So, I mean, there's nothing worse than having that sort of saltwater taffy in the sun feeling that, against your thigh. Just rubbery yuck. All right. So and then they'll put you in a jock strap afterward, and you're back to work in a day or two.
And an ice pack.
Yeah, and an ice pack. That's right. All right. That's all I have on that. What do you got?
I don't have anything.
You don't have anything on that one, Tace?
No.
Okay. Now, there is a female version of this as well. I mean, there's labioplasty for women that don't like the appearance of their labia. Jim Norton used to describe it as like a roast beef sandwich, exploded by an M80 or something like that.
Oh, my.
And but you can have that repaired if you would like. I'm not sure too many women really care too much about that. I know people who make a living off the appearance of their genitalia may care more about that than anybody else. And you can have vaginoplasties, and there's all kinds of things you can do.
Sure.
So, all right. It's not just man having to have this done. All right. Let's see here. Okay, this is a good one because I've been wanting to talk about this for a while. Because when we first started talking about this subject, we didn't have long-term data, but now we do.
Oh, cool.
Okay. So.
Hey, Dr. Steve and all the rest of you.
Hey, man.
I had a question. I know I've called you a couple times so far. This is...
Remember on Gilligan's Island, they'd say, and the rest at the end, after they would do the professor and Mary Ann, and then after a while, they just said, and the rest. So the professor and Mary Ann and Ginger and all them were just, and the rest. So anyway, here we go. All right.
I asked about some
other issues that I had. But I had another question that came up. I have a son and daughter, both 13 and 15, who had their physicals recently here, and the doctor inquired about HPV, the HPV shot.
Vaccine.
Wondering if there are any risks to it, or long-term, short-term, whatever.
Sure.
And I know you've talked about this on the air about, getting the HPV shot.
Yeah, but you didn't pay attention till it was your kids, and I understand that. I'm the same. I'm the same way.
But I'm wondering if there are any side effects or any risks involved.
Yeah.
This is definitely a good topic, that you may be able to bring up on your podcast.
Yeah, man. So the good news is the HPV vaccines are one of the most effective vaccines that we have. They're close to 100% effective in preventing infection of the cervix with the bad human papillomaviruses, and particularly HPV strain 16. And so for the longest time, people were going, well, okay, but we don't have long-term data. Well, now we do. All right. So a study of 1.7 million women found that the vaccine's efficacy or the effectiveness was particularly pronounced among young girls vaccinated before the age 17, which makes sense. And that really doesn't have that much to do with their age. It has more to do with them being sexually active. And, more and more women being sexually active as you get over 17, and some of them already been infected. But during the 11-year study period, there was a 90% reduction in cervical cancer in this group. So
wow.
That is a big deal. Cervical cancer sucks. Ugh. And it is, if you don't get your pap smears, you still have to get your pap smear if you have this shot, by the way. Because there's still, it's not a 0% incidence, and it's not all 100% caused by this particular HPV, or some people have genetic predisposition, so you still get your pap smears. And but back in the day, particularly, and people didn't get their pap smear and they let it go, and they got cervical cancer, and then it became metastatic. In other words, it spread. It was a horrible, horrible disease. So I love the fact that this thing is kicking its ass. Yep. We have a couple other cancer vaccines. One doctor took me to task when I said this is the only one that we really have, but hepatitis B vaccine is actually a anti-cancer vaccine because people with persistent hepatitis B are at risk for liver cancer.
Okay,
yeah.
Gotcha.
And then Tacie talked about the lung cancer vaccine that's coming. And so, I would love to see more of this immunologic approach to eradicating cancer. Sure. But anything we can do to get rid of, this horrible, horrible cancer, I'm in favor of. Now, when he talked about side effects, this one, pretty safe, too. Not only, I don't want to just say pretty safe. It is extremely safe. The majority of the adverse effects are local, pain at the site.
And injection,
of course, no treatment is 100% perfectly safe. So let me look at the incidence. I had this up and I've missed it, or I lost the thread here. Okay, let's see here. Scientific research shows the benefits of HPV vaccine. Yes, of course. They can have some side effects. 135 million doses of HPV vaccine have been distributed since 2006. Most common side effects were mild, included pain, redness, or swelling in the arm. And they go through extensive safety testing. I'm just looking to see if there's fainting can occur after any medical procedure. So there was a certain percentage of people who fainted after that. So they recommend that you give this vaccines to the patient when they're seated or lying down. And there you go. So I am not seeing anything particularly scary with this. And to demonstrate that we put our money where our mouth is, we had our kids vaccinated with this one.
Yes.
Yeah. Okay. All right. Any other questions about that? Okay. All right. Let's talk about a guy that never sleeps.
Hey, Dr. David, Mike from New York.
Hey.
I was reading the esteemed medical journal, also known as the New York Post.
Correct.
And they speak about this Japanese guy who claims in the last 12 years he only sleeps 30 minutes per day.
Yeah.
Now, I smell bullshit, and that can't possibly be true, but if it's in any other literature, if you could take a look and give us your opinion, it'd be greatly appreciated.
Yeah.
Have a great day.
Yeah, thanks, man. There's a bunch of people in the media that have claimed that they never sleep. The one that's the most studied that I could find is a guy named Tai Ngoc, or Tai, let me see if it's Nguyen. It's probably Tai Ngoc. It's Ngoc. He's Vietnamese.
Okay.
So if NGU, what we would pronounce Nguyen is actually Nguyen, I would assume that this guy's name is Tai Ngoc.
Gotcha.
But anyway, he's been pretty extensively studied, and he had a problem with a trauma, I believe, during the Vietnam War. And since then, he has not been able to sleep.
Like a head trauma or a PTSD trauma?
That's what I'm trying. Yeah, it was more of a physical trauma.
Yeah, I'm sorry.
If I remember correctly. And I think that, some people went to see him and monitored him over time, and he kind of lays down and his eyes are open, but he doesn't actually sleep. And he said if he drinks enough wine, he can fall asleep for an hour or two, but that's the most he's ever done. Now, for most people, lack of sleep causes things like dementia and heart disease, crankiness. Yes.
Yeah.
I'm. What are you saying, Tace?
Nothing.
So yeah, I sleep. I don't sleep enough, and it's very difficult for me to stay asleep. I woke up at 5:30 this morning, couldn't get back to sleep. And but there are cardiovascular problems, increased activity of the sympathetic nervous system. That's the one that produces adrenaline, particularly associated with sleep deprivation, has substantial long-term consequences for adults and adolescents. So these kids that stay up all night playing video games and then get up at 6 to go to school, they're at risk too.
Sure.
People who experience sleep disruption have elevated blood pressures, increased risk of developing long-term high blood pressure, and the relative risk is like 20%. And so there are a lot of things that lack of sleep can do, but these people, if they can be believed, don't suffer from those things, because that Tai Ngoc guy is 86 years something. He's in his 80s, I think. I can't find that article, so I'm just talking out of my ass right now. But he's elderly, and so it's there is a huge spectrum of human behavior and things that humans are able to do. And Tacie talked about true human superpowers and stuff like that on this show before. So I'm not too surprised that there are some people that sleep 12 to 14 hours a day.
Sure.
And people who sleep, an hour a day or 30 minutes a day. And the problem is that they're so rare that nobody's really paying a lot of attention to them. So I can't say conclusively that this guy isn't just making this up. The reason I say that is there are people out there called breatharians. Have you ever heard of them? Okay, so breatharians say that they get all of their nutrition from the air.
Oh, okay.
And that is horseshit.
Yeah, I don't.
And I'm sorry if you're a breatharian. I mean, you can tell me. Come and I'll do a clinical study. Yeah. I'll put you in a room. Give me a week, and I'll pay you money. But we'll see how long you go without eating. Yeah. I think one of the guys, and I tried to find this article. I've been terrible with my research this week. Was actually caught eating cheeseburgers, but I'm not.
Oh wow!
I don't know who that was. But it was somebody that was claiming that they never ate. But breatharianism is, something that people talk about quite a bit. in certain circles, it's almost considered a. Are you looking at it now? Mm-mm. Is that what you're looking at? Okay, you're over there typing, so I thought you were looking at breatharian.
I was reading the comments.
But the breatharian thing, it makes no sense. No. Let me say that. No. I don't want to say that
there's a reason you eat and drink.
They're quacks or anything like that. I'm not going to say that. I learned that from Penn and Teller. You can say somebody's an asshole, or you can call bullshit, but don't attack them personally. But what I can say is it makes no sense from a physics standpoint that our bodies run off of chemical energy, which means that they need energy to do that or they will run down. And people who don't eat, we have studies on this, that if people don't eat nor drink for 7 days, they will die. If they only drink, they will live about 60 days. And I'm talking water.
Yep.
Now, you could live off liquid things like Ensure. You could live off of that.
Or oatmeal porters.
Yeah, and stuff like that.
Of those for a while.
I don't know. That's more carbs. It doesn't. Those high carb, low protein diets. People died from those.
Oh yeah, sure.
When some of these weight loss things first came out, they were high carbohydrate, low protein, and their bodies were just eating up their muscles to the point where they got a thing called rhabdomyolysis or rhabdomyolysis, where their muscles were being torn apart to create energy so that their body could live, and because you got to have protein, and then it would affect their kidneys, and they died of kidney failure or other complications. So what they learned was on those high carbohydrate, low protein liquid diets, they had to supplement those people with amino acids, and then they were okay. They could do it for longer and without adverse consequences. But so that tells me, if we see people starving to death all the time in this world, how the F are they starving to death, but the breatharians are just walking around saying, "Oh, I never eat. I never eat." Right? Why? Yeah. And if they have found the way, why aren't they taking that to places where starvation is rampant?
Teach them
how about helping your fellow man?
Yep.
Oh, it's all about you. And getting in the New York Post, I found articles in New York Post and CNN. Couple gets by eating liquid air and stuff like that. And if by liquid air you mean milkshakes and French fries, then I believe it. But anyway, so if someone has any evidence to the contrary, but that's my question. It's the same question that you take to psychics. Oh, you're a psychic. You can tell what happens in the future. Where were you on 9/11? Where were you at Hiroshima?
Yep.
Where were you at Pearl Harbor?
Pearl Harbor, yeah.
Or any earthquake or any natural disaster. Where the fuck were you?
Yeah.
So
I'm with you. Yep.
Jeremiah in the Bible was revered because when he said a bunch of bad stuff was going to happen, it happened. That's why that book is in the Bible, because there were lots of other prophets. They were all saying crazy stuff, but what he said came to pass.
Oh, well.
So that was why. So if the first person that says, "Hey, this is going to happen," without some connection to it, saying that someone's going to be, I don't know, kidnapped or something like that. Well, they may have something to do with it. You can't prove that they didn't. But to say, lightning is going to hit the Eiffel Tower and it's going to cause a fire on the second floor or whatever. I guess there's floors on the damn thing. I don't know. Yeah. I've never been there. Now that, and it's going to happen on Thursday at 8 p.m. Now that would be something.
Yep.
But, just doesn't happen because the future does not exist. I'm sorry. It doesn't exist.
But it's coming.
Yeah. It exists in the sense that time is relative for everybody. So my future is different from somebody that's circling a black hole. But it's not a place we can travel to unless we travel the normal old way, 1 second per second. We travel through time at 1 second per second, which is, by the way, we travel through time the same speed that light does, which is an interesting concept.
I believe we've gone off on a tangent.
Yeah, of course. All right. And speaking of tangent, somebody sent in an AI song for Dr. Scott.
Oh, no.
This one was in the manner of Ben Folds. So let's listen to this real quick.
Oh, Ben Folds is my favorite.
I know he is, but you won't like this.
Oh.
Dr. Scott's in the office.
Oh, my God.
So tall. with a ponytail swinging. He's having a ball. His needles are sharp, but his words aren't too clear. Says that's how they pronounce it. We all share a cheer.
Oh my gosh.
He's got that charm in his quirky way. Dr. Scott is a quack, but he's a pretty good fella. With needles and charms, he's our health propeller.
That makes no sense. See, the AI will just rhyme any two words.
Oh, gotcha.
He's a pretty good feller. He's our health propeller. That makes no sense. Okay, let's see.
Got a nice ring.
Thing he can't pronounce right, but we all know he's got healing in sight.
That's right. There you
go.
I'll put that on our website somewhere.
Oh, that was spatial.
Yeah, you could see it almost kind of Ben Foldsy, but not really.
Kind of, but not really.
But not really.
Yeah.
Yeah. And then there's a country one too, and just. Oh no, this is the jazz one. Ooh.
Oh, jazz is just a bunch of notes.
Floating around.
Yeah.
I love it. I love it.
I can't stand
Dr. Scott in the corner.
There you go.
Tall and thin, with his ponytail swaying. Where do I begin?
There you go. That's what I'm talking about.
In his lab coat, but a heart made of gold. Healing the weary.
Yay. There's a winner there.
Stumbles on words, but they roll off his tongue. That's how they pronounce it. In China, he's some.
Oh my goodness. Oh my God! I'm wondering who put this AI to task.
Long-term listeners will.
Who put the information there?
Here we go. We got one more here. Well, we got this one. Let's try this one here. This is not a song.
Hey, Dr. Steve.
Hey.
I tried that sundial trick to measure my dick circumference. You know what? Stood out there all day with my dick on a sundial. The neighbors called the police, and all I ended up with was a sunburnt dick. Thanks for the good idea.
All right.
See ya.
Thank you, old buddy. What is he talking about? Did we tell people to use a sundial to measure the circumference of their penis?
I mean, I
don't think it was a sundial.
remember that.
I don't know.
He's misremembering something.
Or maybe we are
making a joke. Or we are.
maybe we are.
Now you can make a sundial out of your erect member, but you'd have to keep it erect for a really long time.
Yeah.
There's a way that you can. If you can put a stick vertically, and you would do that by hanging a rope from a rock from a rope, and then lining it up with that. Because if you're on an angle, it's hard to understand where verticality is. Mm-hmm. But you would do that, and then you watch it over time and mark it at different areas. And when you mark it at between, I think, dusk and dawn, and you mark between those, that'll be north. And then once you know north, then you can figure out what time it is. Once you figure out where noon is, when the sun is directly overhead.
Gotcha.
So anyway, you could do that with your dick, but I don't recommend it. No. All right. So, Dr. Scott, I'll go through the super chats here. It looks like Myrtle Manus gave 5 Weird Medicine with Dr. Steve memberships. If you want to get a membership to the channel, I do put up some members-only content from time to time, and you get first look at most everything. Go to youtube.com/@weirdmedicine. And then click join, the join button right there on the front page. And then when you do that, click accept gifted memberships. And then you may get a membership. You don't even have to be here. You just have to be a subscriber. ORS at the movies gifted 10 Weird Medicine with Dr. Steve memberships. Thank you, my friend. And Live Ween became a member of the Fluid family. And, ORS at the movies had a blocked comment, which I'm going to unblock because we believe in free speech. And I think that's what we got. Oh, here's another one from Golden George. Let me see. There you go. Okay. I think it was just because they were commenting on the last story about dick bites and stuff, or, having your rocking out with your cock out to make sundial, and the AI didn't like that. So anyway, what do you got, Dr. Scott?
So let's see. Old Top, truly weird medicine question here.
Yeah, good.
Has any crazy person ever used livestock emasculator bands to emasculate themselves? I wonder
they have.
I wonder about this every spring, banding baby calves.
Sure. Well, you want to talk about what that is, Scott, because you know what that is.
Well, you take a rubber band and put it around their nuts really tight until they chokes off the blood and they atrophy and then fall off.
Yeah, so there are people that don't like this.
Yeah, sure.
Particularly the places like a greener world and stuff like that. They say there's wounds observed in 14-month-old bull calves that are castrated using these emasculator bands. But let's see here. I'm looking at a Quora, and that's not a great medical journal. But it says the elastrator tool puts a green band around the scrotum and the testicle band is pulled in place. And they're saying banding is really better for castration play, not actual castration. And they said if you really want to castrate anyone, by the way, don't do this.
Yes.
I would suggest Burdizzo clamp. So we got to look that up.
Oh, geez.
See what that is. Look that up. Burdizzo. Either way, if you go with an elastrator, your balls just die and dry up, and ideally they fall off after a week. They might not, though, but with Burdizzo clamps, your body absorbs your balls. That's why that's better. Oh, my God. This sounds horrific.
Yikes.
So, yeah, please don't do this on humans. It's not fun. And if you really, for whatever reason, feel you need to be castrated, please go see a medical professional. Did you find out anything about Burdizzo?
Yeah, they look like professional, like clamps that you would clamp some testicles off with and then probably snip them. Yeah, they look like real deals.
Oh, my goodness.
Yeah,
okay.
That's got to hurt.
Castration device employs a large clamp designed to break the blood vessels leading into the testicles. Once the blood supply is lost, the testicular necrosis or dying of tissue occurs. The testicles shrink, soften, eventually deteriorate completely. Okay, so that's what they're talking about in that post. They kill the blood supply, and then the testicles just shrink and stop functioning.
Yep.
But they die, though. So you've got dead tissue in there. Don't do this. We are telling you, sometimes I say, hey, don't Google image this, and then I'll spell it so you can Google. I'm not kidding. Don't do this.
No.
Absolutely not. All right. It's insane. I'm not sure why we have to feel like we have to repurpose everything to for sexual purposes, I don't get that part. I mean, I do get it, but we should stop doing it. All right, you got anything else?
That'll do her, Dr. Steve.
Right, okay, very good.
Thank you, guys.
We appreciate y'all.
Appreciate you.
Thanks always go to Dr. Scott. Thanks to everyone who's made this show happen over the years. Listen to our SiriusXM show on the Faction Talk channel. SiriusXM, channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern, on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Go to Dr. Scott's website. It's simply herbals.net for stuff that really isn't crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. Thanks, everybody.
Thank you.
Thank you.
Ryan Seacrest here. When you have a busy schedule, it's important to maximize your downtime. One of the best ways to do that is by going to ChumbaCasino.com. Chumba Casino has all your favorite social casino games like spin slots, bingo, and solitaire that you can play for free for a chance to redeem some serious prizes. So hop on to ChumbaCasino.com now and live the Chumba life. Sponsored by Chumba Casino. No purchase necessary. VGW Group. Void where prohibited by law. 18 plus terms and conditions apply.